How does psychotherapy work with a diagnosis of ADHD? Well, there's an important difference, I think, that needs to be understood between what diagnosis means in mental health and what it means medically. Because medically, we're used to the idea that diagnosis, I think correctly, means that the cause, the origin of a condition has been identified. Whereas in mental health, a diagnosis really means that some descriptive framework has been found to describe some aspects of your experience. A set of characteristics about how you behave, how you feel, fit something called ADHD. It doesn't mean that the diagnosis has in any way identified a thing, like a problem that needs to be fixed or a cure for this problem. It's just a description of an aspect of you as a human being. But the word diagnosis can sound like it's found the thing, it's found the root cause. I don't think that's true. So when you come to psychotherapy with a diagnosis like ADHD or OCD, BPD, etc., you've got to realize that the therapist isn't going to say, oh, I know how to fix that. Really, all that is a shorthand for a set of things that will be quite particular to you. It won't even be a universal set. But it's a shorthand for some characteristics about how you experience life, how you get through the day. It's not really that different to you showing up and saying anything else about you. I'm high energy, or I'm depressive, or I feel lonely. It's a description of some part of your experience. And what we do in therapy is look at why you're like that. And that why might have many different impacts, including some things that sound and are identifiable as ADHD symptoms. But the diagnosis doesn't really tell us the cure. It's just part of the description of you. And that's how we use it.